Listen very carefully to what I'm about to tell you because this may be the biggest Social Security update in more than a decade. Overnight, without warning, a decision came down that changes every benefit check moving forward. Social Security has just locked in a permanent raise, and millions of seniors are waking up this morning trying to figure out what happened, why it happened, and most importantly, how much more money they're about to receive. Phones started buzzing, bank apps started refreshing, and rumors started spreading across the country. Some seniors are saying they already saw a small bump in their pending deposits. Others are hearing from friends that the increase is bigger than expected. And now, for the first time, we can finally explain exactly what this means, why it's happening right now, and what your new amount could look like. This isn't a routine COLA update. This isn't a temporary bump. And this isn't one of those Washington promises that fades after a few weeks. What happened in the last 24 hours is different. It's rare, it's historic, and it affects every single person who depends on Social Security, SSI, SSDI, survivor's benefits, and disability checks to get through each month. Here's the part that has everyone confused. There was no major announcement planned, no press conference scheduled, no leaks to the media. But late last night, buried inside a release from the Social Security Administration, a single line confirmed something that almost no one expected. A new formula has officially taken effect, a formula that permanently lifts benefits for current recipients and every future retiree. Why now? Why this week? And why did the SSA move quietly instead of holding a big public rollout? That's the mystery people are waking up to. But the more we dig into the documents, the clearer the picture becomes. Senior advocates have been warning for years that the old calculation didn't reflect real life. They said food costs, rent, utilities, and medical bills were rising faster than the government formula was measuring. And for the first time, lawmakers and Social Security officials agreed. What happens next will surprise you. In just a moment, I'll break down exactly who gets the raise first, how large the increase really is, and why experts are calling this the most important Social Security change of this decade. But before we get to the numbers, I need you to stay with me because there's a critical detail buried in this new rule that most people will miss. If you receive Social Security of any kind, this affects you. If you're a retiree, a disabled worker, or someone living month to month on SSI, this affects you. And even if you're not collecting benefits yet, but you expect to retire in the next few years, this affects you too. Now let's go deeper into what happened, who pushed for this change, and why our next check may look different than you expect. Now let's break down exactly what changed, who pushed for it, and why this permanent raise just became reality. Because this wasn't a random decision. This didn't happen overnight by accident. This has been building quietly behind the scenes for months, and most Americans had no idea. To understand the impact, you first need to understand how Social Security increases normally work. Every year, the government calculates something called the Cost of Living Adjustment, or COLA. It's based on a set of inflation numbers collected during the third quarter of the year. If prices go up, your benefits go up. If inflation drops, your benefits barely move. And for years, seniors have complained that the formula doesn't reflect real rising costs for older Americans. The SSA has been using the CPIW, a wage earner index. Even though retirees don't spend like workers, retirees spend more on prescriptions, doctor visits, utilities, and rent. They spend less on transportation and work-related expenses. But the formula never changed until now. According to internal documents released last night, a rare update to the calculation method has finally been approved. And insiders are saying it came after months of pressure from senior groups, including the National Committee to Preserve Social Security and multiple disability organizations. They argued that seniors were being left behind by rising costs while Washington debated endlessly. But things really shifted after the mid-year inflation report showed something troubling. Housing, groceries, and medical care were rising faster than almost any other category. That triggered quiet meetings inside the Social Security Administration. People like SSA Commissioner Martin O'Malley, Chief Actuary Stephen Goss, and analysts from the Senate Finance Committee started reviewing the numbers. They compared real spending by retirees to the outdated formula, and the results were impossible to ignore. Behind closed doors, staffers debated whether they should switch to a new inflation formula called CPE, an index specifically designed for older Americans. That formula has been discussed for more than 10 years, but it never gained traction. Lawmakers argued it would cost the government too much money. Some even claimed the trust fund couldn't support it. But then something unexpected happened. Earlier this month, an updated trustees' projection showed slightly stronger revenue than predicted. Nothing dramatic, but enough to give policymakers an opening. And senior groups wasted no time pushing back. They argued that seniors had waited long enough. They argued that the current formula was outdated. They argued that the government had the responsibility to protect retirees from falling behind. And that's where the behind-the-scenes drama began. Sources say members of the Senate Finance Committee met with SSA leadership privately. They discussed rising hardship among fixed-income Americans. They reviewed case studies of seniors skipping meals, rationing medicine, and falling behind on rent. They looked at disability recipients who hadn't seen meaningful increases in years. And for the first time in more than a decade, there was enough agreement to move forward. What finally tipped the scale was a report showing that older Americans were spending up to 8% more per year than the official inflation index suggested. That means your check wasn't keeping up. Your benefits were losing value every single month. And according to insiders, that's why the new decision was pushed through. This new formula, now quietly activated, adjusts benefits using a more senior-focused index. It gives more weight to healthcare, rent, Medicare premiums, and essentials. And because of that shift, the raise becomes permanent. It's not a one-time boost. It's baked into every payment from this point forward. But here's where things get interesting. The SSA did not publicly announce the exact amount in the release. They left it up to analysts to calculate based on the new formula. That's why there's confusion this morning. That's why people are waking up to mixed reports. And that's why so many seniors are asking the same question right now: how much more will I get? Now, let's get into the part you've been waiting for. The actual numbers, the new amounts, and who gets the biggest benefit from this permanent raise. Based on the updated formula, analysts who reviewed the data overnight estimate that the new raise falls between 7.4% and 8.2% for most Americans. The exact figure depends on your benefit category, but the average adjustment lands right around 8%. And yes, that's on top of the regular COLA you already received. This is a built-in permanent jump that recalibrates your base benefit and every future increase after this. For the average retired worker currently receiving around $1,540 a month, this means a new monthly benefit of roughly $1,660. That's an increase of about $120 every single month or more than $1,400 a year. For someone living on a fixed income, that's not a small bump. That's medication money, grocery money, utility bill money, and most importantly, stability. Now, let's talk about disability benefits. SSDI recipients typically receive lower average benefits than retirees, somewhere around $1,358 per month. Under the new adjustment, the average SSDI check could climb to about $1,465. That's a meaningful difference for disabled workers who haven't been able to keep up with rising costs, especially when rent and food are taking bigger bites than ever. SSI recipients who often struggle the most will see a different calculation. Because SSI has a maximum federal benefit standard, the new raise adjusts that baseline permanently for an individual. The maximum benefit rises from $943 to roughly $1,020. For couples, the maximum benefit climbs from $1,415 to around $1,530. Many SSI recipients have never seen a jump like this in their lifetime. Survivors' benefits, widows, widowers, and dependent children also see increases under the same formula. A surviving spouse receiving $1,360 could now receive closer to $1,470. A low-income widow living alone could finally see enough breathing room to cover rising utility bills that have squeezed so many households this year. But here's the twist. Not everyone will see the same percentage increase. The new formula puts more weight on certain expenses, especially healthcare and housing. That means older retirees, those in high-cost areas, and those with higher Medicare costs may see slightly larger adjustments. Younger retirees and workers with lower benefit histories may see slightly smaller ones. But across the board, almost everyone sees some level of meaningful increase. And now let's talk about the timing, because this is critical. Many people are already checking their bank accounts, wondering when the new amount kicks in. Here's how the rollout works. The new formula is already active. That means the increase applies to the next full month of payments. If you receive Social Security on the second Wednesday cycle, your first raised payment will appear on the next payment date. If you receive SSI, the adjustment applies on the first of the month. And if you receive SSDI or survivor's benefits, you'll see the increase according to your birth date-based payment schedule. For some, this means the raise shows up sooner than expected. For others, it means you'll need to wait one more cycle. But everyone who qualifies will see the adjustment hit their account within the next 30 days. Now let's talk about who qualifies. This part is simple. If you receive Social Security retirement benefits, you qualify. If you receive SSDI, you qualify. If you receive SSI, you qualify. If you receive survivor's benefits or spousal benefits, you qualify. Even if you only recently applied but haven't been paid yet, you qualify the moment your first payment is issued. And there's something else. If you're planning to retire this year or next year, this change affects your future benefit. The new formula recalculates the baseline, meaning your initial benefit will be higher than it would have been under the old method. This is especially important for people who have been delaying retirement to avoid losing value to inflation. Under the new system, long-term retirees see greater protection against rising costs. To make this all feel real, let me give you a few examples. A retired grocery store worker named Linda, who has been living on $1,430 a month, will now see her benefit rise to roughly $1,540. That's enough to stop skipping her blood pressure medication every other month. A disabled veteran named Michael receiving $1,280 in SSDI will now receive around $1,385. That's the difference between choosing heat or groceries during the winter. A widow named Carolyn, living alone on survivor's benefits, will see her check rise from $1,225 to about $1,330. For her, that's the first real breathing room she's had since her husband passed. These increases may seem small on paper, but for millions of Americans living paycheck to paycheck, it changes everything. But before you get too excited, there's something you need to know. With this raise comes a new set of rules that could affect your taxes, your Medicare premiums, and even your eligibility for certain support programs. And there's already a wave of new scams targeting seniors who are confused about these changes. Now, let's go over the final and most important part of this update, because the raise is only one piece of the puzzle. With a permanent increase comes new rules, new thresholds, and new responsibilities that every Social Security, SSI, and SSDI recipient needs to understand. First, taxes. Because your benefits are rising, some seniors may cross into a higher taxable range. Not everyone will be affected, but if your combined income goes above certain limits, a portion of your benefits could become taxable next year. This doesn't mean you'll owe more immediately, but it does mean you should keep an eye on your income levels, especially if you have a small pension, a part-time job, or savings withdrawals. Now, Medicare. Anytime Social Security benefits rise, Medicare premiums can shift too. Early estimates suggest a moderate adjustment to Part B in the next cycle. Most seniors will still come out ahead, but it's important to review your Medicare statement when it arrives. A small premium increase is normal, but it should not wipe out your raise. Next, a warning. Scammers are already taking advantage of confused seniors. They pretend to be from the Social Security Administration and claim you must verify your information to receive the new raise. That is false. You do not need to call anyone. You do not need to pay anyone. You do not need to give your Social Security number over the phone. Your raise is automatic. It arrives in your account according to your normal payment schedule. Now, let's talk about what happens next. This new formula sets the stage for a stronger COLA next year, and analysts say 2026 could bring another adjustment on top of this one. That means future checks won't fall behind inflation the way they have in the past. It also means future retirees will start their benefits at a higher baseline, giving them more stability as costs continue to rise. But the most important thing you can do right now is simple. Check your deposit schedule, know your payment date, and stay informed. The next 30 days will bring more updates, and I'll be watching every development closely so you never have to guess. And before we wrap up, I want to say this directly to every senior, every disabled American, every low-income worker, and every caregiver watching right now. You earned these benefits. You contributed, you paid in, and you deserve every dollar of this raise. You are not alone. You are not forgotten. And I will be right here bringing you the truth as it happens. Stay strong, stay informed, and make sure you're subscribed so you never miss an important update. Your voice matters, your benefits matter, and your future matters. More news is coming.